3 sessions into practice, when you become pharmacists or pharmacy technicians, right? So from my point of view, as your colleague facilitating this session, I think that these lectures should be able to define and kind of describe, in its entirety, what the dispensing process should be or is in terms of standard. Clearly, basic steps that form any dispensing process, either be it in the hospital or in the pharmacy or in the community of practice, wherever you find yourself as a pharmacist technician. What are the step A to Z, 1 to 10, that is expected when you are dispensing to a patient? That is the first expectation. Now, the second expectation is beyond just dispensing as a process or as an act. How would you apply legal as well as ethical principles in dispensing? Dispensing is beyond you issue a drug to someone, take, go and drink. There are ethical as well as legal moral principles on what you're expected to do as a specialist within this field, even as you dispense to a patient. So it's the expectation that you'll be able to gain the required knowledge to be able to be compliant as well as ethically correct when you're dispensing to any patient or individual. Then lastly, recognizing, I think is very important to be able to recognize our role as pharmacy technicians within the overall patient care and patient safety. So, this is our expectation that once you're done with this course, as it relates to dispensing, these are the things that you should go home with. Okay. So next slide, we'll look at the objectives of the learning. So expectation is in the future, right? What we expect you to do with this learning. But the objective for this next 3 weeks that we'll be having this conversation is simple, straightforward to the point. As a pharmacist technician, you should be able to define what dispensing is. Dispensing is very core to pharmacy, right? And in pharmacy, what do? You handle drugs. The drugs is not for you. The drugs is to be issued to someone else. And so core at the heart of the practice of pharmacy is dispensing. So you should be able to define it, honestly. And more importantly, why is it important within, the pharmacy practice? That is one. Then secondly, you should be able to speak to each step of the process. And had mentioned about, legal as well as ethical requirements. You should know why you should do what you're supposed to do at what time. You should be able to know what is the gold standard when it comes to dispensing. There are things that we do on a day-to-day within our country, within our context, but there are also global standards on how things should be. Similar to dispensing or compounding or any other process within the pharmaceutical space. So we should be able to know that these are the ideal practices, even as it relates to dispensing. Then, as technicians, knowing that dispensing is at the core of what you do, you should be able to recognize simple common errors. For you to know something is right, it's important to know when it is wrong. And so as a technician, you should be able to know common, simple errors that happens within the dispensing process. But more importantly, how do you prevent it? Prevention is better than cure, our people say. So what are the errors that are commonly found within the practice and how do we prevent it? So that at the end of the day, ultimately, the patient, we're safeguarding the patient's safety, right? When it comes to treatment, when it comes to the outcomes of any health intervention. Then largely we look at just some few case studies on how, dispensing has been practiced over the years. So those are, the objectives I hope for this session, and I want to believe that as students of this course, please take out time to develop your own personal objectives from lecture to lecture. As you come to learn, what do you intend to take out from every learning session that you attend, including dispensing as a process. So we'll go right into it. Next slide, please. Good. So as a way of introduction, next slide, please. So like I had mentioned, right, dispensing is very, very fundamental, is basic. It's crucial in any pharmaceutical practice, right? It actually serves as a link between or a physician or anyone that prescribes, treatment or takes a decision on the treatment approach for any patient. Dispensing serves as that link, but to translate that decision from a doctor to safe and effective use of medicines by the patient. What that means is if the doctor or prescriber says, okay, give this person XYZ drugs to address XYZ illness, you actually have to give the patient the drug, right? Letting the patient know what is expected in order for the patient to actually, get health outcomes from that treatment. So it's a really it's really important. It's not just any routine tax. If you're in the hospital, you see pharmacies or you see technicians, and it's just like, okay, go over the counter. They just hand you over the drug. They say take one, two, three, take one or two, three, morning, afternoon, night. No, it's beyond that. It has to do with a lot of thinking, judgment, clinical judgment. A prescriber gives a treatment, a prescription. As a technician, before you dispense, you have to look, you have to make your own judgment. Is this prescription correct? Is it right for the patient? Based on all of the information that this patient is a child, this patient has been throwing up, can they swallow? All of that. As a technician, you also have to put in your own judgment before you do a dispensing process. It looks at legal compliance. So by legal, it means that both internationally as well as within Nigeria, there are standards that have been given. You have to do A, B, C, D. As a pharmacist technician, you're the last person to see the patient, right? The doctor or the nurse, sees the patient and all of that. As a pharmacy or a technician, you are the last person to see the patient before they leave the hospital. So it is very, very, very important that you ensure that there is compliance in how the patient administer the drugs to ensure the kind of result or outcome that you want. You're the last person that talks to the patient. I hope you're following. So the doctor talks to the patient, what is doing you, they go to the nurse, she takes temperature and all of that. If it's something that has to admission has to happen, okay, they go to the ward. But if it's an outpatient situation, as a pharmacy technician or as a pharmacist, you're the last person that sees the patient before they leave the hospital. So it's you have to be able to communicate to that patient in a way that they leave the hospital confident of the services that they've already received. And so how you talk to the patient, we call it patient-centered communication. You talk to the person as an individual, being peculiar to what their needs are at that time. So, the role of dispensing is very, very critical. And lastly, you have to be accurate. You have to be accurate. If a patient is meant to receive paracetamol to treat headache or pains, any part of the body, you cannot give them Piriton. That is a disaster, you know. So you have to be accurate. And so dispensing the entire process is not just issuing of drug. There are a lot of things that goes into it in the dispensing process, you know. So WHO has actually done some estimates as far back as 2017 that it costs the health system so much money, about over 42 billion US dollars every year, as a result of error that results in, you know, the treatment process, medication process, you know, we're even excluding other costs. And so if we make a mistake as a technician or as a pharmacist at the point of dispensing, it costs the entire health system so much money. It means either all the policies that have been done, or you know, the workforce, the doctor, the nurses, you look at, or you know, all the finances, the money that has gone into the entire process. At the point of dispensing, any error that happens, it has spoiled the entire you know, process of care. So that's many other ways, you know, you can look at this. It's not just a tax, it's not just issue drug, you know, a lot goes into dispensing. Please, next slide. Okay, so let's continue. In Nigeria, Nigeria, like any other many other developing countries, we have our context. You know, I had mentioned that you know, there are international standards as well as there are national standards. But even within national systems, Nigeria, for example, there are so many challenges that you know affect the system. So either issues surrounding fake drugs or substandard drugs, you know, limited access to technology. Our dispensing systems are still very much analog. You know, we've not been able to digitalize them. Then, you know, NAFDAC has said just last year that amongst other challenges is the fact that our health workforce, you know, personnel that are available within the hospital or the health system itself, you know, is dwindling and is going down really fast. For some of you that are tracking all the Japa incidents, you know, if you listen to the news, you will see how the ministers and the commissioners are shouting that doctors, nurses, pharmacists are leaving the hospitals. So, you know, the shortage of qualified pharmacists and technicians is also affecting the process of dispensing. And so if you have one technician that's supposed to dispense to maybe an average of 10, 20 patients per day, you know, we're having to have to deal with 50, 100 patients or more per day. So that is also affecting the quality of services, you know, by pharmacy technicians, you know. Again, to reiterate, the role of pharmacy technicians is beyond preparing of medicines. You know, I listened to the lectures on compounding yesterday. It's beyond that. It's beyond, you know, getting active ingredients, mixing them up and issuing. It's actually ensuring that there is safety for patient, safety to ensure that the expected outcome, the kind of outcome that we want, health outcome from that patient, is guaranteed. There are no drug interactions, meaning when the patient takes the drug, it doesn't react with another drug or with another food that they've eaten. And more importantly, errors that is associated with labeling or just wrong practices is avoided, you know, in any area of concern. Next slide, please. Hope I'm not going too fast. Please, if you have any question, you can raise up your hand and I would respond. So I had mentioned, right, that the dispensing process is not just about handing out drugs. No, Number one, you have to understand what this prescriber intended, meaning that once you get a prescription, right, either from a doctor, a physician, a surgeon, or anyone, you have to be able to look at the prescription paper and say, by the combination of this drug, it seems that this is what the doctor wants. There's an antibiotic here, so there must be an infection. There is a paracetamol here, and there must be pain somewhere, So you have to be able to understand what the prescriber wrote and what it intends to achieve from the description, meaning if there are antibiotics want to cure some form of infection, etc. So that is one of the things that a pharmacy technician needs to know. Secondly, you have to be able to ensure that the medicine is appropriate for the patient, right? Meaning it has to be the right drug, it has to be in the right dose, it has to be administered in the right way. If it's an oral drug, it has to enter the mouth. If it's an IV drug, it has to go to the veins. And lastly, it has to be taken in the regimen, the dosage as it's supposed to be. So meaning if you're supposed to take it after drugs, after eating or with food, it's important that the pharmacy technician ensures that the medicine is appropriate for the patient. All right. Then thirdly, I had mentioned it has to be in the correct dose and form. If given 500 milligram or 1,000 milligram of paracetamol, it's appropriate for an adult, but might be too much for a 4-year-old or 10-year-old, depending on the situation. So you have to make sure that it's in the correct dose and form. By form, a 4-year-old might not be able to swallow. So you want to make sure you're giving them paracetamol that is either in a suspension or is in a syrup. That's what it means that you're preparing it in the correct dose and form. It has to be labeled and packaged well. So when you put a drug on an envelope, you have to put the right correct name of the drug, how many times it should be taken, how many number of tablets or capsules, expiry, when it's expired to expire, for how many days. If it's supposed to be taken for 3 days, you don't put 7 days. So there's a lot of attention and detailing that goes into the technician practice at the point of dispensing. Then lastly, as a technician, you are the right or handman, of the pharmacist, because you would have to help in counseling the patient. If it's an HIV patient, for instance, at the point of issuing the drug, beyond just the drug, you have to learn to counsel them, you will have to learn to encourage them, and any other patient generally that comes to the hospital or the pharmacy or the community to access care. You're the last person that discusses with them and give them confidence that the right treatment has been given, and reassurances that they'll be well. So in summary, dispensing is beyond transferring medicine from shelf to patients. Take, go and drink. No, it's beyond that. It is structured, it is a professional process, and there are standards both globally and nationally to secure the patient's safety. And finally, technicians are very, very, very important, indispensable actors in ensuring that medicines are used safely, effectively, as well as legally. Okay, next slide, please. Good. So that's introduction. Just finished, introducing, giving the concept, setting the tone, for the dispensing process. So I would like to ask a question. Anyone can respond. When you think of dispense, the word dispense, what other terms, synonyms, can you use to describe dispense? What other words can you use to describe dispense or dispensing? Can anyone hear me?
Well, I would say yes.
Okay.
Like, well, I would say to give out.
To give out. Brilliant. Thank you, Dr. Stephanie. Okay. What other words? Another word for dispense. In keep in where poker. I'm so sorry. You need to unmute and help me pronounce your name first. Let's start from there.
Yeah.
Unmute yourself. Unmute yourself. Okay, you would, when you find the unmute button, if you go to the phone, the speaker, just click on it, you will unmute. You can't find it. All right, that's fine. Arize, you're trying to say something.
Hello, ma.
Yes. Hello. Please pronounce your name.
Weak Wonka.
Aha, weak hawker. All right. So give me another word for dispensing, to dispense.
Selling
Like supply.
and supply.
Okay. Supply. Okay. To give out, to supply, to distribute, to allocate, Yes, so thank you. You're all correct. There are so many words that we could use for dispensing. But let's look at, standard definitions generally when it comes to pharmacy practice, how people or systems see dispensing. So let's look at some few international definitions. So we have some international bodies. We have the International Pharmaceutical Federation. We have WHO. Everybody on this call must know WHO. You've either heard WHO on the news, or you've gone to the hospital, you've seen WHO, or either on a document, you must have come across WHO. WHO is an agency of the United Nations. Basically, what they do is they coordinate international public health issues and emergencies. If you've heard of COVID-19 or Ebola, I'm sure you would have heard of WHO, right? So they set standards of how health systems should respond. So, WHO has defined in their own terms what dispensing should be. And, they've defined it as the process of preparing and giving medicines. Dr. Stephanie said to give out, you see, so you're correct. The process of preparing and giving medicines to a named patient on the basics of a prescription or other legal requests, including the advice needed for safe and effective use. Now, it's so much big English, but at the heart of it, it says, from the point of you prepare, you give, it has to be customized to a particular patient, right? That is, it is patient centered. The person has a name, on the basis that you received a prescription from a doctor, a physician, meaning as a technician, it's not standard practice means you shouldn't give drugs without a prescription. So you're giving the drug to in whale cooker, right? On the basics that she has gotten a prescription from a doctor, either in a hospital or in a pharmacy, ensuring that it is legal is a legal request, but more importantly, you're providing the needed advice for her safety and effective use of that medicine. So that's how WHO looks at dispensing. So let's see another definition for dispensing. Please, next slide. Next slide, please. Yes. MSH. right? Management science for health. So, you have WHO, they are the policymakers. They sit down in their big offices and they define what dispensing is. From that policy, at that international level, it goes to implementation. So you have systems or partners that implement. Within the space, we have partners like MSH. They've been, within the health system for a long time. They provide support to hospitals on disease intervention. So they have walked the talk for a long while. They have also defined, based on their experience, what dispensing is. So MSH defines dispensing as all the activities that occurs between the time a prescription is presented to the time
Yes.
the medicine and other prescribed item is given to the patient. You see, it's from end to end. So from the doctor down to the technician or the pharmacist. So anything that happens in between is called dispensing, right? So it speaks to a workflow. It speaks to process from you verify the prescription, you prepare, you issue, you advise. So anything that starts from the doctor down to the end, to the technician, to the point of issuing out the drug or medicine to the patient, that is dispensing, okay? So lastly, let's come back to Nigeria and see how we define dispensing in Nigeria. Please, next slide. Okay, so Nigeria also have our systems. We also have our structures. We have the Pharmaceutical Council of Nigeria. We have NAFDAC. I mean, and if you're in Nigeria, you have to know NAFDAC. From the time of the Inque dwellers, you must have heard expired drugs. You must have heard they are shutting down pharmacy and all of that. They've gone to Aba. I mean, if you're in the newspaper, trying to prevent, the issuance of substandard goods and medicines. So what NAFDAC does basically is to ensure standardization across the country. They look out for fake products and services. It's just a regulatory body. But then you have the Pharmaceutical Council of Nigeria. Again, they are also regulatory. They ensure that all the regulations and just control generally within the practice of pharmacy in Nigeria. So PCN in 2025, just recently, they defined dispensing as the act of you prepare, you package, you label, and then you supply the drug to the patient on the basis of a valid prescription accompanied with appropriate advice, again for safety and rational use. Okay. NAFDAC also has, made emphasis around drug authenticity, safety, as well as patient protection. Please, next slide on this. Now, no matter who is defining dispensing, please, next slide. No matter who is defining dispensing, either it's the big guys, the WHO people, or the partners, or in Nigeria, or even within our hospital setting, or even you, Precious, if you're to define dispensing today, there are 4 things that must be reflected in your definition. The first one is it has to be on a legal basis. That is, there must be a prescription or a professional authorization for a drug to be given. So it has to be legal, right? That is the first thing. The second thing, when you're looking at dispensing, it's a process. It's not just take drug, take, go and drink after you eat. It's a process. It starts from you prepare, you package, you label, you advise before you issue. So it's both a legal process, it's a technical process, then it's also a process that provides information. You across all the definitions we've heard, you would hear advice, advice on safety and rational use, advice on safety and effective use of medicines. So dispensing ensures that the patients understand A, what they are taking, that they know the drug they are taking, B, how they will take the drug, C, how they will use it, how they will store it to ensure that the drug maintains its potency, safe use of drug. Then lastly, at the heart of any dispensing process is because you want the patient to get well, right? There's an expectation, there's an outcome. You want to ensure that the patient is safe and the therapeutic results or effect that you want that to be achieved as a pharmaceutical technician that will be dispensing. So I've taken so much time to talk about the dispensing itself as a context. We have looked at different definitions. What is dispensing? I would pause at this point. If anyone has any questions or any context you want to provide, or you want to share an experience. Okay, no questions, no bad experience with a technician in the past that has given you drug without giving you advice on how to take it. Okay, that's fine. There are no comments. We would move on to the next slide, please. Next slide. Okay, so we've introduced dispensing. We have tried to define what dispensing is and why. You know, like what's in now? What's the big deal? You can as well just go and over the counter get a drug. I beg, madam, give me paracetamol there. And just hand you over the drug and you move away. Like, what's the big deal? Why should dispensing matter? There are four reasons that are we've penciled down on why dispensing matters. And if you've listened to the presentation since from the beginning, it will just be to reiterate some of the things that we've said on why dispensing matters. Please, next slide.
Welcome, sir.
Next slide, please. The first ulti- ultimately as a critical health practitioner, as a technician, you're very, very important, within the system and the role that you play. Ultimately, you want to protect your patient, right? You want to protect the patient and the safety of your patient. You want to ensure that by checking prescription, ensuring that the labelings are correct, that the right drug reaches the right patient at the heart of it. You will be devastated, if you give a patient a wrong drug, either if they're in the hospital on admission or they go home and then something happens, the patient dies. Okay, something happens, the patient dies. Nobody wants that on their conscience. So, it's important that patients, please, can you mute? Okay, sorry, not patients. In way cooker, please mute. It's important as a pharmacy personnel that you act as the last defense against any form of harm that will go to the patient, right? You're the last person to see the patient before they leave. So you're the last hope for the patient to correct any mistakes or any medication errors. So that's the reason why dispensing matters, right? For example, doctors these days, they're really overwhelmed. So many patients, they have to navigate between outpatient cases, they go to theater, there's so much pressure. And in the heart of that, we're all humans. There can actually be an error in prescription, or treatment that is being issued. If a technician or a pharmacist does not identify that, it could lead to either an illegal dose or something that could really cause harm to the patient, and that is not what we want. If something happens to if any one of you has practiced within the hospital even for a short while, when there's an issue, especially if it's related to something that the patient takes, I can assure you that before they go and find the nurse or the doctor to ask what happened, the first stop is the pharmacy. And you can go and ask, because that is the last person that is providing safeguard to any treatment process. So it's really serious, and it's a serious business. So please, let's look at the next slide. Why dispensing matters. The next slide. Next slide. Next slide, please. Okay, thank you. So we've spoken a lot about patient safety. The other thing that we did mention in the course of our conversation is preventing errors. Again, we cannot over reiterate the fact that errors within treatment, or within the medical practice, errors are inevitable because we are humans, because a lot of our processes are manual. We are prone to mistakes, right? But as a technician, you stand the chance to prevent medication errors, as the last person standing. So it is important that errors that can be preventable should be prevented. Like, we don't need people to die because of wrong drug that they took. It's almost unacceptable, So dispensing matters, because if you dispense rightly, you will prevent deaths, you will prevent harm, you would ensure that the patient gets the results that we want. And an error could be at any point. It could be either at the point of prescription, could be at a point of preparation, or even counseling, and dispensing to the patient. So at every point, a pharmacy technician needs to be on their guard. You must be on your guard to ensure that we prevent errors, basically. So next slide. Next slide, please. Next slide, please. The dispensing matters because at the heart of it, right, you're contributing, or you're supporting the success of any treatment. Next slide, please. So if a doctor does a right diagnosis, for example, the doctor did the right thing, the nurse did the right thing, gave care, and then it gets to the pharmacy, or it gets to the technician, any error on your part, the entire process of care would have been jeopardized. So see it that the role of a technician, specifically as it relates to dispensing, contributes significantly to the success of any treatment process or endeavor within the hospital. Again, I keep saying dispensing is not only about handing over medicines. No, you're prioritizing the patient, you're communicating to the patient, you're ensuring that they understand the instructions, you're ensuring that the kind of support that they need is given, you're giving them advice on side effects. So it's very, very important for we to know that the dispensing process ultimately contributes to the success of any treatment endeavor. Please, next slide. I don't know if it's changed, but from my end it's not. All right, I think I've spoken to this. It supports the treatment process successes. Please, let's look at the next slide. Okay. So lastly, dispensing ensures that it matters because it's a legal requirement. And by legal, the first thing that comes to your mind is crime, right? It must be there. There are standards and guidelines that must be adhered to, and any attempt or any negligence in not doing that, it becomes a problem. It could be a legal problem. Have you not heard of when people dispense wrong thing, people take them to court? Have you not heard when patients die, they actually take them to court, the hospital is sued, and as part of the case, they would ask for every department, including pharmacy, what role they played in the death of a patient. So it's really a legal issue. If we're not compliant, the government of Nigeria expects that dispensing should be legally done. By legally, it must be from a prescriber. It has to be medical personnel that we handle it generally, and the patient is absolved of any liabilities because the patient must trust the health system, that is handling their care. So I think I would stop here for today. Basically, again, just to take you through what we've done, we'll be taking this thing in small bits so that people are able to internalize what we've discussed, and then we can come back next week and take on the next aspects of dispensing. Next week, we'll be looking at history. How did dispensing evolve? How did we get to where we are today as it relates to dispensing? Next week, we'll look at the dispensing process itself. So please just recap for today. We have looked at the context of dispensing, we've looked at some definition, we've looked at why dispensing matters. I'm happy to take on any questions or if you require any clarifications on any aspects of what we've discussed today. I'm happy to provide. And any other colleague on the call that has, um, you know, other additional perspectives to provide, all welcome. Thank you. Does anyone have any questions? Any comments? Okay. Okay.
Can I,
Dr.
can I
Good. Please.
Blessing,
ask a question?
Mr. Blessing,
Yes. Good evening.
you you did excellently well, and I was so impressed. I'm so impressed with the lecture.
Thank you.
In fact, it's a wide range coverage. A lot was said that was for insight, total insight. So, as many as much of us that have been able to listen should be able to know that the insights were much. Is beyond the slides. So they should be able to go into more practice of insight on how dispensary is an evolution and the history of evolution. When you're talking of dispensary, they should be able to know that there are innovations in
Mm,
dispensary today.
mm,
And as such, sometimes they may be privileged not to work in Nigerian locality. They may work beyond Nigerian locality. So
mm,
if you're working outside Nigeria, you should be able to know that dispensary is online, dispensary is system dispensary,
mm.
dispensary is AI,
Yeah.
dispensary is basically technology,
Mm,
is beyond counter dispensary.
mm,
So these are the innovatives that are innovations that are in the system. So they should think beyond what they have been able to learn today. Thank you so much for In fact, you are an ancient teacher. Thank you so
Thank,
much.
thank you, Prof. Thank you, Prof.
I
And
commend you so
yes,
much.
Prof. Next week we'll be looking at historically how the practice of dispensing has evolved, and all that you've said. I'll make sure I take note and include that. Thank you so much, Prof.